Welcome to Flip Your Script, the vodcast from the American College of Lifestyle Medicine that's all about clinicians redefining care through lifestyle medicine. My name is Dr. Padmaja Patel, and I'm the current president of the American College of Lifestyle Medicine and serve as Chief Medical Officer for Nudge Health. Each episode delivers 5 key takeaways from leading experts and practitioners on how lifestyle medicine is reshaping the future of healthcare. Through practical strategies and real-world success stories, we empower you to make a lasting impact in your practice and beyond. In this episode, we're honored to be joined by Dr. Ajay Joseph. Dr. Joseph is an interventional cardiologist at St. Francis Health System in Tulsa, Oklahoma. He joined St. Francis after completing his cardiology training at Rush University under the mentorship of Dr. Kim Williams, one of the pioneers in plant-based nutrition and preventive cardiology, whom Ajay credits for changing the path of his professional life. He's board certified in lifestyle medicine and completed courses in plant-based nutrition from eCornell and chef coaching from Harvard. In 2022, he launched a pilot lifestyle medicine program for St. Francis employees, the success of which then led to the launch of the first and only comprehensive lifestyle medicine program in the state of Oklahoma. He's passionate about the power of lifestyle medicine in changing the lives of his patients and the community by empowering individuals through a comprehensive whole-person approach. Welcome, Ajay. How are you doing today?
Thank you, Padmaja. Really glad to be here.
Wonderful. I'm glad you could find some time out of your very busy practice. So to start, I want to ask you if you could briefly share what drew you to lifestyle medicine and how that journey shaped the way you think about integrating lifestyle medicine in cardiology practice.
The journey started with my own health. I came here in 2012, joined a busy residency, and the stress of residency, the rigors of residency, fast food, lack of exercise, poor sleep, stress. Literally all the pillars of lifestyle medicine started affecting my own health. And within a few years, I was borderline pre-diabetic with my cholesterol were through the roof. And I came across Dr. Kim Williams as part of my cardiology training. And he basically showed me the light that, these are things that are within our control. I started following his advice, started exercising, biking to work, changed the way I eat. And I saw the difference in my own health. My sugars went down. I lost weight, the 30 pounds that I put on. My cholesterol's dropped, and the question obviously came to me. If I could do this, why can't this be offered to my patients as well? And that naturally led me to the field of lifestyle medicine, and that's what brought me to my first conference in 2019, and it's been a journey since then.
Yes, and I remember our very early conversations.
Yes.
When I was back in my lifestyle medicine center at Midland Health. So yeah, we've come a long way.
Yes.
So when you first started building a lifestyle medicine program within a cardiology-heavy health system, what surprised you the most? And whether, was it related to clinician resistance, patient readiness, or what worked faster than you had expected?
I think what really surprised me was, we traditionally have an idea that, Oklahoma patients are not going to change the way they eat, or, but this is the South, now what are you talking about? But what really surprised me was that if we give information in a way that's palatable with a real good roadmap of how you achieve that, patients are going to do what you tell them to do.
Yes.
If we give it to them in broad strokes as go home and change your diet, that doesn't work. You have to make it doable for them. So if you make it, and that goes for all the pillars of lifestyle medicine, be it exercise, sleep, stress management. And what was really surprising for me is that those pre notions that we have that, folks are not going to change their lifestyle, that was probably the most humbling aspect for me, that it's our job to give the information. We are not even if we can't make decisions for patients, our job is to give the information. And I've been humbled by the changes that our patients have made when you give them advice in a palatable form.
Yeah, and I relate to this so much because I'm here in West Texas.
Yes.
Right? A very different, patient community, just like how you say Oklahoma, there is this assumptions that people are not going to change their diet or lifestyle. And in fact, people are hungry for the information. And we as clinicians and physicians, we have the power in our words. They come to us for advice. And when you give a very concrete, specific advice, what is it that they need to do and why, and explain the scientific reason of making those changes, yes, everyone, I have been pleasantly surprised as well with the amount of response that I received. So I so agree with you, and I think that's really should be a take-home message today from our conversation. If we could really help clinicians to think again and not make those assumptions about patients, right? Thinking that no one is going to change their lifestyle or behaviors. So thank you for highlighting that. How do you explain to your cardiology colleagues that lifestyle medicine isn't just nice to have or something extra, but actually a core clinical intervention, particularly for patients like post-PCI, post-CABG, or even for patients with atrial fibrillations?
Yeah, to be honest with you, it's been a very easy sell to my cardiology colleagues. I mean, they understand it, right? They understand how important diet, exercise, sleep, all these pillars are. I mean, one of the bigger sources of referrals to our clinic has been our AFib, our EP electrophysiologist, because there's such compelling data. And to say that if you have, in fact, a recent arrest trial out of Australia, I mean, 50% reduction in redo ablations for patients who go through a structured lifestyle medicine program. So there's just such compelling data. And what I do is that I just share this data with my group of 30 cardiologists. And it's been a really easy sell for me to tell them. And, especially when you add that on to the fact that, you see less recurrence of angina, less coming back for redo stenting, ballooning, angioplasties, and restenosis, the data is pretty compelling. So it was an easy sell, to be honest with you, telling my colleagues. And that's been really encouraging, actually.
For clinicians who feel overwhelmed or time constrained, what is the smallest meaningful first step they can take to begin integrating lifestyle medicine into their cardiovascular practice?
I think that's where the resources that ACLM has come so handy, right? I mean, you could just literally go and become a member, get those resources, have a flyer for each of the 6 pillars ready for you to give in your patient rooms, have it ready on your wall rack. I think starting there itself will completely change the way you would practice cardiology over the next few years. So I think that starting small with those flyers that ACLM has is probably the lowest hanging fruit that you can start with. And then based on the buy-in that you have from your health system, start building on maybe a pilot program with your employees, figuring out who are the at-risk populations that your employee wants to work on. But I think starting really small with those just patient handouts itself is a big deal.
Yes, so those patient-facing resources, many of them are actually freely available, even to non-members. So thank you for highlighting that. Yeah. So zooming out, what do you see as the unifying role of lifestyle medicine in the future of healthcare, and how might cardiovascular disease serve as a gateway for broader system change?
Yeah, that's where the unifying theory of lifestyle medicine comes in. There isn't a separate lifestyle medicine for your heart, a separate lifestyle medicine for your brain, or for cancer survivorship. It's all one and the same.
Right.
And that's kind of how we frame our program as well. There is no bar, there's no entry level. Anyone can come in, everyone benefits from this. And the way I think we should look at this is that this should be the foundation of all care at every point of care, be it ER, be it rehab, be it inpatient, literally every point of care lifestyle medicine should be the foundation of how we deliver care. And that's not necessarily something unique. It's just basically following all the guidelines. That's what every guideline says. Start with lifestyle. We've just been jumping that hoop for the past 40 years.
Yes, very well said. Yes, clinical practice guidelines definitely highlight lifestyle medicine as the first line of intervention. So, well, thank you, Ajay, for joining us and for sharing your passion and expertise, especially for redefining cardiac care through lifestyle medicine. Your insights truly highlight the power of evidence and innovation in transforming patient outcomes. Thank you to our audience for tuning into this episode of Flip Your Script. We hope today's conversation has inspired you with practical insights on how lifestyle medicine is shaping the future of patient care. If you enjoyed this episode, don't forget to like, subscribe, and leave a comment. Stay connected with us for more episodes featuring clinicians who are rewriting the script on health, one patient at a time. Until next time, take action, make an impact, and keep flipping the script on healthcare. Thank you.
Thank you, Padmaja.